The day of the long-awaited move into the promised land has finally arrived. The provincial leadership of the Eastern Cape Department of Health has given the thumbs up for the Frontier Regional Hospital in Queenstown to operate from the newly built state-of-the-art facility. Acting CEO at the hospital, Dr. Mushid, said they are grateful to the provincial leadership for the upgrades done to the hospital.
I would like to say thank you to the leadership of the province, our Premier and our MEC for giving this beautiful building to this community and to the staff of Frontier Hospital. We are busy preparing for the opening of the new casualty, the pediatric wards, as well as, the pediatric OPD.
The personnel are just as excited over the prospect of operating from the new building. Acting head of medical services at the hospital, Dr. Simpiwe Mdingi, said the new casualty will help to improve their services.
I'm excited about the opening of the new casualty. So our new casualty is gonna make managing our the patient flow better, and also because I've worked in casualty for the past 8 years, it's in my blood. So when we talk about casualty, that excites me, and having this new casualty is gonna make, I think, treating the Queenstown community better, because our process flow is gonna improve, and our system, having our trial system is gonna improve, and it's making it easier for us to implement the things that we wanna implement to work better in an environment that is conducive, and the equipment and the things that are here are top. The beds, the resource areas. So as a clinical, we are excited to work in this casualty.
With the move from the old to the new building, Nursing Area Manager Mrs. Nomasista Kolisa envisages that more personnel will be required in order to meet the standards of the new facility.
But coming to the new buildings, they are much bigger. It's like when you have been staying in a 4-roomed house, then you are moving now to a 10-roomed house, you will have to need more of equipment. That is, in this case, we'll be looking for more nursing personnel so that our service delivery can never be compromised at any given moment. We'll be having a right flow of the nursing personnel, because whenever we're performing our duties, we're aligning ourselves with the requirement of the 6 priorities of the Department of Health, of which one of them is the waiting times. Now we're having more personnel, then the waiting times are going to be reduced.
The first phase of the move into the new building is due to be completed by Friday, the 6th of November 2020.
So the first phase, it was the current building where we are now, that is having, the admin block, the outpatient department, as well as the casualty. And the second phase and third phase, it will cater for the laundry and as well as the kitchen, plus the rehabilitation center.
The newly built state-of-the-art Frontier Hospital is one among many accolades that confirm the commitment of government to provide better services to the people of the Eastern Cape. Anele Valela, Eastern Cape Department of Health, kwisebe lezempilo laseMpuma Kapa, Queenstown, kuKomani.